forward to welcoming you to our hospital's international courses.
We are delighted to launch the first international educational program series at Imam Reza General Hospital, Tabriz, Iran.
Tabriz is a historical and vibrant city.
You will love our beloved city.
Join us for our educational programs.
We'd love to have you here.
Waiting for nice days together.
See you soon!
Hello everybody, I'm again from here, COVID studio in Imam Reza Hospital to present one other course provided by one of the academic members of this university, this hospital. Today I'm pleased to host Dr. Farnood from Department of Nephrology in talking about the course provided by her, and we will talk a little bit in detail about the course and some information about the title. Thank you, Dr. Farnood, for accepting our invitation. I would like to ask you to introduce yourself, your educational background, your daily practice as an introduction to enter the title of the course.
Hi, I'm Dr. Farnood, a member of Faculty of Internal Medicine of Tabriz University. I'm nephrologist. I have a undergraduate postdoc fellowship in immunology in kidney transplant, and in this section I would like to discuss kidney transplantation as the best option of a treatment in high immunological risk ESRD patient.
Very good. I think we need to explain a little bit more about some terms used in the course title and what you talked here. End-stage renal disease is a known condition. We know about it. And what we need to know a little bit more is the oversensitized patients. Who is a patient who is oversensitized, and what you do for such kind of patients?
In the term of survival, kidney transplant is the best option for ESRD patient. But in the patient, we have monitored DSA that names antibody against HLA. Kidney transplant in this patient is not very easy, and this patient have a very poor survival and poor graft function, and we must monitor the DSA in this patient. Sensitization is very, very bad event in this patient. Sensitization means we have blood transfusion, we have recent kidney transplant of pregnancy, a very bad event in this patient. For this reason, we monitored DSA and decided to use new strategy in this patient. One of the strategy is we use the Luminex test in this patient. Luminex, that means we follow DSA antibody in 1 class and 2 class, and this antibody by titration is very important for us and nephrologists.
As a next question, I would like to ask you to tell us the title of your course. What is the course exactly? The name of the course and the duration of the course you recommend, and also the eligible persons who can participate in the course.
My title is Kidney Transplant in Highly Sensitized Patient and Pre-Transplant Evaluation in all kidney transplant candidate. I think 3 months is sufficient for this fellowship, and all of nephrologists in this field, I think we could pass this fellowship.
Okay, so the participant should be a nephrologist to participate, exactly. Is it flexible as a duration? For example, if the participant needs a longer period to get more experienced.
Exactly.
It is
exactly.
It
is flexible. For this example, in the COVID pandemic, we have a very few candidates for kidney transplant, and this pandemic we have a very few transplantation in this period. I think exactly this period is flexible.
Very good, thank you. At the end of our conversation, if there is another thing that you want to tell us and we missed to address, I will be glad to hear.
Desensitization is a very complex process. In this process, firstly, we evaluate DSR antibody, and then we use some and special drugs for block only of the process in antibody production. For example, B cell is very important in this process. Antibody is produced by plasma cell, and we could block this plasma cell. We could decline the process of desensitization. Some special drugs is very important in this process, and we choose some agent of this production for antibody production and antibody sensitization.
Very good. And as far as I know, as a urologist, the number of transplant cases in our university has passed the 1,000 during these years, and the center is quite an experienced center, both in nephrology arm, in urology arm, and there's a huge experience encountering different types of patients, and I'm sure that you provide a very valuable course for the participants. We are going to finish the talk, and if you wish to tell us the last words in conversation, we are glad to hear.
Many of kidney transplant candidates, because of having DSR, the process for a waiting list is very long, and this quality and the quality is not good for this patient, because kidney transplantation the only best option for this patient, and in this section we have to facilitate the transplantation in this field. I hope that with this new strategy, many of the patients with DSR and highly sensitized patients would benefit with this strategy.
I'm sure, yes, you are right. This was a conversation about one of the valuable courses provided in our hospital, Imam Reza Hospital. If you need more information about this course and other courses provided in the university, Tabriz University of Medical Sciences, please follow us on the website or follow the addresses subtitles below to contact with our expert team. And thank you for watching.